Visiting on Wellness Wednesday with Dr. Mark Tommerdahl. And Mark Tommerdahl is going to be at Okoboji Wellness Clinic on Tuesday, March 11 for a meet and greet at 6 p.m. and a presentation with Dr. Meyer and his team from 6:30 to 7:30 p.m. about something called brain gauge. Dr. Mark Tommerdahl, welcome. It's a pleasure to visit with you.
Yeah, thank you. It's a pleasure to talk to you.
So if you'd be so kind, what is, in a nutshell, brain gauge?
Well, brain gauge is really exactly what it sounds like. A gauge is something you measure with. The brain, everybody knows what the brain is, but you always wonder, well, how good is my brain? How healthy is it? And, we basically developed something. We call it a lab in a mouse. It looks like it has sort of the shape of a computer mouse, but it's not a computer mouse. What it does is it vibrates. It's something that vibrates your fingertips. And with those vibrations, we're able to probe brain function and get very accurate measures of brain health. And it's pretty easy to use and pretty inexpensive.
And this has been developed and studied over many years. That's
correct. We've started the basic science of this. I've been doing this since the early 1980s, and the basic science of this started back then, and it sort of evolved until we started working, not just in the lab with animals, trying to understand how the brain works. Once we sort of had a handle on some fundamentals of the brain, we wanted to see how well we could measure them in humans, because there's a countless number of neurological problems wrong with humans, and you can't study them all in the lab. But you want to help people that have all these issues, and particularly things like aging. It's really hard to have aging models in the lab. But we want to be able to track people's progress and see what kinds of things work for getting people better.
Yeah. So, Dr. Tommerdahl, how easy is it to use this brain gauge?
Brain gauge works on any laptop or computer. You simply plug it in, download the app. Takes about 30 seconds tops to download the app, and then run the app. And it will take you through a series of questions, and you just answer the questions, put your hand on the brain gauge, which is just, like I said, looks like a computer mouse with a couple of little probe tips that will gently vibrate your fingertips, and it'll ask you some questions. As long as you can read, you can do the brain gauge. The youngest we've ever had do the brain gauge is age 3 or 4, but somebody needs to read for them. And the oldest, we've pushed 100 years old on the other end.
Wow. So what kind of results are people seeing, Dr. Tommerdahl?
Well, we've got really good accuracy and objectivity for differentiating, say, between healthy people who are fully healthy and things that are gone wrong, say people with concussion. We have, in studies, we've seen 93% accuracy in terms of differentiating between concussed and non-concussed people. And the other thing that we do is, say, for concussion, when somebody is playing sports, a lot of the tools that are out there now aren't real accurate. And they generally say people are ready to return to play after they've been whacked in the head, within a week or so. But that's usually not the case. And a lot of times parents of high school or college athletes will contact us and get a brain gauge so that they can evaluate their own child and say, oh, okay, they're not ready. And then it takes 2 to 3 weeks for somebody to, well, it's never safe to get hit in the head again, but, you do want to make sure, a secondary concussion that's too close to the first concussion can be dangerous. That's just in the concussion world. The other thing that we're seeing is, there's a lot of treatments out there for a lot of different neurological disorders or insults, and people are using the brain gauge to track and see how well it responds to those treatments. The other thing that people use it for is to see how well their supplements work. Like you've probably seen lots of supplements and drugs advertised where somebody says, hey, I use preparation QRZ and look at me, I'm so much better. Are you?
Yeah,
Are they really better? Well, they're not measuring anything. They're just saying they feel better. Just saying you feel better doesn't mean you're better.
Yeah.
I'll give you an example. One example where you don't feel better, you feel better, but you're actually not better, is when you're prescribed opiates. And we've seen that before. People who are taking opiates, their brain function is actually worse. So I guess that's the short version of some of the results. We've got over 120 publications across a really wide range of studies.
That is just incredible. And you said for post-traumatic stress that this is also a tool that can be used there?
Yeah, so people were using this as a tool to see, okay, what works best for helping people with PTSD. And, patients are a little bit like snowflakes. Everybody's different.
Mm-hmm.
So there's no silver bullet, especially for PTSD. There's no silver bullet for treatment. But, you want to see which treatment is working. And, in that particular study, people were doing everything from equine therapy to mindfulness to different types of supplements, drugs, and talk therapy. And they wanted to see, well, which of these works? And all the therapies work, but they work differentially for different people. So some people got better with some things, and some people got better with other therapies. And it was very useful to see what worked for who.
So this is absolutely awesome. So people are given some sort of treatment, some sort of supplement, whatever the case might be, and the brain gauge is able to track whether or not you are seeing results in the treatment that's been prescribed.
Absolutely. Yeah, and this is really great, especially in the aging population. I'm 66, full disclosure.
Yeah.
And as we get into this age group, a lot of people have a lot of anxiety about their brain and how fast their brain is aging. And, that we have a 90-second quick check test, and it's not as much of a deep dive scientifically as the full standard battery, which takes 15 to 20 minutes. But the 90-second quick check is really good at tracking response to things like supplements, drugs, and brain training, by the way. The brain gauge has been used for brain training, or is used for brain training for a lot of people to actually strengthen their cognitive reserve, improve their reaction time, and keep them, cognitive reserve is one of those things that you really want to keep improving on or maintaining. It's sort of like keeping your physical fitness maintained to keep physically fit and stay healthy. You want the cognitive reserve, and improving cognitive reserve is what fights dementia.
I want to talk about that just a little bit in the time we have left here. I just happened to watch NASCAR a few weeks ago, and the drivers were talking about their reaction time. And they all talked about knowing when it was time to retire was when their reaction time began to go the other way, because they all have just amazing reaction time. So we can actually train ourselves to hang on to that reaction time a little bit.
Absolutely. And, I wear a lot of hats, but, my background was in neuroscience and engineering, but I also had a pretty significant background in competitive athletics.
Oh.
And one thing I learned from that was speed drills work. And so the brain gauge has speed drills. And the brain gauge, by the way, on a side note, it's the only commercial tool out there that can actually measure your reaction time accurately. It measures it down to 1/3 of a millisecond, which is and reaction time is a really important feature. How fast can you react? But another feature that we can measure with that same test is called reaction time variability. And that may not mean anything. Somebody say, oh, this is just statistics. It's like, no. When you take a reaction time test, you want to see how does somebody respond, say, 10 tests in a row. And you do it, 10 times in a row, and you see if they're very consistent, that means they're well-focused. and their attention span is really good. This correlates very well with attention. Somebody with ADHD, their reaction time variability is really high. They can't focus. Somebody with early dementia, their reaction time variability is terrible. But we're the only people that can actually measure that. So in 90 seconds, we can give you a measure of speed, accuracy, and how well you can pay attention. So that's a really important measure to say, well, how well can somebody focus? And you can see, and that changes really fast. And my students, I used to teach 50, 60 students a semester, and they'd all get brain gauges, and they'd all use them, and they'd all for their labs and projects and whatever. But they would also do their own little studies on themselves, and they'd all like to see, well, how does I wake up in the morning and I'm kind of I don't test too well, and then I start taking my couple of shots of caffeine, and I do a lot better. And then they always want to try a few more shots to see if they get even better, but then their focus gets much, much worse.
Yeah.
So there's the whole point of the brain gauge is to try to optimize brain function. So taking a supplement only helps if you need the supplement. Taking too much of the supplement might actually hurt.
Yeah.
So what's going to optimize your brain function? And so you sort of have to research your own brain health a little bit.
Yeah.
But it's really easy to do if you have the right tools.
All right, we've got to get going here. So will the brain gauge be available at Okoboji Wellness Clinic?
Yes, it will.
Okay.
Yeah, we'll have a few there for demonstration, and I hope to see a lot of people there.
All right. So again, that presentation, that meet and greet, will be Tuesday, March 11, 6 p.m. meet and greet at Okoboji Wellness Clinic. Presentation 6:30 to 7:30 p.m. with Dr. Meyer and his team, with Dr. Mark Tommerdahl. The cool thing about this, and we've heard this term in the last few months, repetitive science. You've got many years, decades of repetitive science on the brain gauge, so it's something you've seen work and come to fruition over decades of study.
Correct. That's correct.
Yeah.
Many decades. We've seen it in the clinic, we've seen it in clinical research venues, and we've seen it in the lab work.
Wow.
So it's a true, science from hypothesis 40, 50 years ago up to fruition. Today. To finished product.
So intriguing. Dr. Mark Tommerdahl, thank you so much for your time. We look forward to your time at Okoboji Wellness Clinic with Dr. Meyer and his team. Can't thank you enough. Have a great day.
Yeah, thank you. Have a great day.
Dr. Mark Tommerdahl with us today on another edition of Wellness Wednesday.